Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of MRCP within the last 5 years and want to help you do the same. We are not associated with any MRCP examination organisations, and the materials covered are by no means an exhaustive list of what can come up in your exam, or indeed medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is a question series all about allergies and primary immunodeficiency.
So let's do some questions. Which of the following statements is correct? A. Anaphylactoid reactions are IgE-mediated reactions. B. In a suspected case of an adult with anaphylaxis, the required dose of adrenaline is 500 microgram of 1 in 10,000 dilution. C. Measurement of mast cell tryptase is helpful to differentiate between an anaphylaxis and an anaphylactoid reaction. D. Anaphylaxis in patients on beta blockers may be refractory to adrenaline. E. Patients can be discharged from the acute medical take as soon as they are stabilized after receiving adrenaline for anaphylaxis. So if you want to pause the video and have a think about your option, we are going to go through it now. So the correct option is option D. So we will go through all of them one by one. Anaphylactoid reactions are non-IgE mediated. This is something that we discussed in one of the beginning slides if you were paying attention. Option B, the dilution of the adrenaline is incorrect. The correct option would be 500 microgram of 1 in 1,000 in the case of an adult anaphylaxis. Option C, it's incorrect because mast cell tryptase is actually not helpful between differentiating an anaphylaxis and an anaphylactoid reaction. Option E is also incorrect because stabilizing the patient is one thing. However, it's really important to admit the patient after they are stabilized in order for them to be monitored for at least about 12 to 24 hours in case of a recurrent or a delayed reaction. And option D, therefore, is the correct option. And that is true that if the patient has been on large doses of beta blocker for long term, they may be refractory to adrenaline. And in those circumstances, it's really important to inform your intensive care colleagues or critical care colleagues for consideration of the patient for level 2 or level 3 care. Options are A. Phosphatenema, B. Senna, C. Lactulose, D. Arachis oil, and E. Movicol. And the correct option in here is Arachis oil. This is somebody that those of you who have an interest in gerontology probably are already aware of this, but Arachis oil is nut-based, so it's really important to be avoided in patients who have an allergy to nuts or peanuts. It's fair to say that all of these options can be used as laxatives for treatment of constipation, but Arachis oil is the only one among them that contains nuts and therefore is the correct option in here.
So let's try a question. A 65-year-old patient currently on chemotherapy for lymphoma presents feeling generally unwell and with hemodynamic instability. He is found to have cytopenias with a neutrophil count of 0.1. He has a temperature of 39.4 degrees Celsius on the news chart. He informs the IMT2 clerking doctor that he is allergic to penicillin, with a previous reaction comprising an urticarial rash over his limbs without airway compromise. Which of the following statements is incorrect? So, these are your options. A broad-spectrum intravenous antibiotic is indicated. Tazocin must be avoided at all costs given his previous anaphylactic reaction. Antibiotics should not be delayed until blood culture results are available. He should be closely monitored if he receives a penicillin preparation. Oral antibiotics is unlikely to be therapeutically suitable in this case. So I'll just give you a minute to think about that. So this is a case of neutropenic sepsis on a background of lymphoma and chemotherapy. So we already know that he's quite unwell and will require broad spectrum antibiotics at the very least. So we are looking for the incorrect statement. The first answer, therefore, is correct. A broad spectrum intravenous antibiotic is indicated. The second answer, tazocin must be avoided at all costs given his previous anaphylactic reaction. Now, if we read the vignette, we can see that he has not, in fact, had an anaphylactic reaction. His previous reaction comprised a rash, and we are told specifically that there were no signs of airway compromise, as would be seen in an anaphylactic reaction. So it's possible that B may be the incorrect answer, but let's look at all of the others. Answer C tells us that antibiotics should not be delayed until blood culture results are available. This is definitely correct. He should receive antibiotics as soon as possible. Answer D, he should be closely monitored if he receives a penicillin preparation. Now, this is most certainly correct because we know he's had a previous adverse reaction to penicillin preparations, which comprised a rash, but it did not comprise anaphylaxis. However, we do need to monitor him carefully, just in case the reaction this time is different, if at all present. Answer E is that oral antibiotic is unlikely to be therapeutically suitable in this case. This is also correct because he has neutropenic sepsis on a background of immunosuppression and is very unwell with it. So he really does need IV antibiotics and admission. So in this case, we come back to answer B, and this is incorrect. And so we can select this for the answer. Let's now try a question. So, in evaluating a patient for common variable immunodeficiency or CVID, which of the following findings is least likely to be consistent with this diagnosis? So our options are low serum levels of IgG and IgA, B, normal to increased numbers of B cells, C, good response to polysaccharide vaccines, D, recurrent bacterial infections, or E, chronic gastrointestinal symptoms. I'll just give you a second to have a think about that, given everything we've talked about in this video. So the answer which is consistent with the least likely finding in a person with CVID would be option C, a good response to polysaccharide vaccines. You will remember that this is actually one way that we test for presence of the condition by looking for a response to past immunizations, which may well be weak in these patients. All the other options may be seen in a person with CVID. So our options are monthly intravenous immunoglobulin infusion, or IVIG, daily prophylactic trimethoprim sulfamethoxazole, regular infusions of fresh frozen plasma, bone marrow transplantation, or high-dose corticosteroids. So it's really important in the MCQ exams for part 1 and part 2 to really know what the question is asking specifically. So in this case, it's asking for the most appropriate prophylactic measure to reduce the risk of PCP pneumonia. So in this case, the correct answer is B. So prophylactic trimethoprim sulfamethoxazole. For the overall treatment of hyper IgM syndromes, A or D could also be considered, but this is not what the question is asking.
So let's do some questions. Which of the following statements about severe combined immunodeficiency or SCID is correct? A is primarily a T-cell immunodeficiency disorder. B is typically caused by an overproduction of antibodies. C is usually diagnosed in adulthood. D can be effectively treated with antibiotics alone. E is characterized by the absence or severe deficiency of both T cells and B cells. So the correct answer in here is option E, which is characterized by the absence or severe deficiency of both T and B cells. So recall that from our discussions earlier, this is involving both T and B cells. Therefore, option A is incorrect. This is not something related to the production of antibodies, and it's frequently diagnosed in childhood. And as we discussed, the management is not going to be surrounding antibiotics alone, and you need to be thinking about the immediate management versus long-term management, as we discussed earlier.
Okay, so let's try a question. Which of the following is a key feature of chronic granulomatous disease? So just think back to all the information we've covered in this video in order to help you. The possible options are hypercoagulability, leading to deep vein thrombosis, deficient production of hemoglobin, impaired phagocyte function resulting in recurrent bacterial and fungal infections, excess production of red blood cells or polycythemia, or elevated levels of thyroid stimulating hormone or TSH. So if you recall, the correct answer here is C, due to impaired phagocyte function, and therefore we get these recurrent bacterial and fungal infections in CGD.
Let's do some questions. In the context of hereditary angioedema due to C1 inhibitor deficiency, which of the following statement is correct? A, is most commonly triggered by histamine release. B, acute attacks are effectively treated by antihistamines and corticosteroids. C, C1 inhibitor deficiency leads to uncontrolled activation of the kallikrein-kinin system. D, is typically associated with urticaria and pruritus. E, C1 inhibitor deficiency is an autosomal recessive disorder. So the correct option is option C, which is C1 inhibitor deficiency leads to uncontrolled activation of the kallikrein-kinin system. The other options are incorrect because remember, this condition is not an anaphylaxis or an anaphylactoid reaction. Therefore, it's not really triggered by histamines. As a result of it, it doesn't really cause pruritus or urticarial symptoms, and therefore the treatment of it is not going to be with antihistamines or corticosteroids. Therefore, the correct option is going to be option C.
Thank you for listening to this episode of Bite-Sized MRCP. If you like what you've heard today, give us a thumbs up and hit the like and subscribe button below to make sure you don't miss our next episode. Let us know in the comments which topics you would like to hear in future. See you in our next episode.